Hello. Most everyone has been affected by alcoholism in one way or another. It may be an immediate relative, a close friend, or a coworker. Alcoholism is by far the highest rated addiction in the world today. The cause of alcoholism varies from one person to the next. It could be genetics, living arrangements, childhood experiences, psychological problems, and peer pressures. Many people start drinking to run from personal problems or to hide their feelings, whether it's depression, loneliness, marital problems, or job-related issues. Regardless of the reasons, alcohol usually makes their problems much worse. Physical problems such as heart and liver disease, ulcers, cancer, brain damage, and others are all caused by alcoholism. According to Dr. A.H. Mokad, alcoholism is one of the leading causes to highway fatalities, teen and adult suicide, domestic violence, and job loss. With all these factors staring us in the face, the question must be asked: what can be done to decrease the number of alcoholics in today's society? Understanding that alcoholism is a disease, just like diabetes or cancer, and providing the proper treatment to those who suffer from this disease could be the best way to keep these numbers from increasing and possibly save someone's life, especially the lives of those affected by actions of an alcoholic. Today we're going to discuss three things. What is alcoholism? The strategies that treat alcoholism, and finally, how employers and insurance companies can take care of employees needing treatment for alcoholism the same way they do for someone who has any other disease. So first, let me define alcoholism for you. Alcoholism, also known as alcohol dependency syndrome, is a disease that affects almost 100% of our population in one way or another. It is usually characterized by the following: cravings, physical dependency, impaired control, and denial. Dr. Howard Westman gives insight to the definition of this disease by writing this, and I quote, "Addiction is a primary, brain-based, largely genetic behavioral issue that is chronic, progressive, incurable, and in most cases terminal. It's an illness in itself. Most psychiatrists used to think that addiction was a manifestation of other illnesses or personality traits. If you had an addiction, you needed treatment for depression, anxiety, or personality disorder. In the last 15 years, it has become clear that addiction has its own biology and natural history. You do not have to have any other diagnosis to explain addiction." End quote. So, let's talk about some strategies to treat alcoholism. Efforts to address alcohol and other drug problems are usually characterized into prevention, intervention, treatment, and aftercare. Prevention approaches are aimed to the individual citizens to provide them with the knowledge and skills to avoid alcohol and other drug problems. Intervention refers to a program strategy that's aimed as persons who have begun to use alcohol and other drugs or have begun to experience some problems as a result. However, if we are to address the questions of how to decrease the prevalence of alcoholism in today's society, then we must begin to offer the last two strategies of the treatment. Treatment is usually provided to those individuals who have many serious problems caused by their use of alcohol and other drugs, or who are addicted to or dependent on drugs. Treatment programs are often highly structured and involve intense therapy. Aftercare, also referred to as rehabilitation, is an important part of the strategy to treat this disease. Once the individual has become free of alcohol, the program must seek to help the individual re-enter society without returning to the destructive patterns that they are used to and which led them to treatment. Now that we've defined the disease and discussed methods of treatment, how can employers and insurance companies strive to take care of individuals needing treatment in the same way that they do others with any other disease? Efforts to address alcohol and other drug problems are usually categorized into... Alright, let's stop. And now that we have defined the disease and discussed the methods of treatment, how can employers and insurance companies strive to take care of individuals needing treatment in the same way they do with those who have any other disease? First, let's understand the impact treatment has in healthcare reform. Prevention and treatment is a major key to reduce healthcare cost. Through these programs, we reduce the cost associated with spinal cord and head injuries from impaired driving, chemotherapy, and radiation for treatment of alcohol-related cancer, emergency room visits, and images for broken bones and internal injuries. According to analysis published in the Journal of the American Medical Association, we could reduce the nation's expenditures on health care by $90.4 billion if alcohol problems were properly treated. It further cites that currently the federal government spends about $50 a person a year on prevention, treatment, and intervention related to fighting the addiction problems. Since many employers are beginning to focus on the wellness of their employee population in an effort to drive down the company's medical expense, it only makes sense to include treatment options for those who suffer from alcoholism. Investing money on the front end would save millions in the long run. Prevention is the sum of our efforts to ensure healthy, safe, and productive lives for all Americans. People who suffer from alcoholism have a disease, and it's not one that should be taken lightly. It's just as severe as cancer, diabetes, and health disease. It'll kill a person, and it does not discriminate. I urge you to seek options for treatment for anyone you know suffering from this disease. Okay, now that we've discussed alcoholism, the strategies for treatment, and what can be done by employers and insurance companies, which would save the nation millions, if not billions of dollars. Let's come together and make this happen. So join me, and let's save some lives. Thank you.